My area of research is equine upper airway disease, and specifically using diagnostic imaging such as ultrasound to look at these diseases further. I've been working on this since 2004. Our research is aimed at early screening for an important disease of horses called roaring. Roaring is a disease that is known to be progressive, and it's been shown that the microscopic signs of this disease happen prior to the abnormalities that we see when we scope a horse's upper airway with a video endoscope. What we're looking to do is to bridge the gap between those two things, so using diagnostic imaging to detect microscopic findings without the need for a biopsy. This will not only allow us to identify disease before its onset and advise clients and owners about the future potential of the horse and additionally intervene earlier with treatment, but also will avoid the need for more invasive diagnostic methods. Our goal is to provide horse owners with a reliable, easy, readily available, and inexpensive way to screen horses for roaring prior to the onset of clinical signs. This will allow people who are both buying and selling horses, and additionally people who are trying to career plan for their own horse, to have a better idea about the future airway potential and/or limitations of any individual horse. Some parts of our research have already had an impact within the industry. Specifically, before the onset of ultrasound to diagnose roaring in horses, the most accurate way to diagnose roaring was by using an upper airway endoscope during exercise. This can happen either on a treadmill or, with more recent advances, can happen trackside or within an arena while the horse is performing. The wireless video endoscopes are less invasive than the treadmill, but these are both expensive tests. An ultrasound is a much more widely available test and is less expensive. Our preliminary work has already established and been backed up by other researchers at other institutions that ultrasound is as accurate as upper airway video endoscopy performed at exercise. During our initial work with the 3D ultrasound equipment, we've already been able to establish that it's actually more accurate even than a CAT scan in looking at muscle volume in the larynx. The use of ultrasound to diagnose roaring hinges on the fact that horses who are roarers have abnormal innervation to the muscle that's responsible for opening the upper airway. These muscles, because their nerve is abnormal, become fibrotic. The fibrosis of this muscle can be seen not only under the microscope, but also with ultrasound. So the principle that we're really trying to extrapolate from is that horses who are roarers, not only do they eventually develop abnormal opening or function of the upper airway that can be seen with the video camera inserted through the nostril, but prior to that, horses who are roarers have abnormal appearance of their muscle, and ultrasound gives us a window into that without the need for an invasive biopsy procedure. We are so excited about our recent acquisition of 3D ultrasound equipment. This equipment was made possible by a donation from the Equine Foundation of Canada. This equipment will be used initially to advance our research in upper airway. The disease that we're interested in when we talk about upper airway and 3D ultrasound is a disease called dorsal displacement of the soft palate. This is a disease that affects racehorses predominantly and essentially results in abnormal airway function at maximal exercise. Recent work by ourselves and colleagues at other institutions has reinforced the importance of the relationship of the upper airway muscles, the bones that suspend the upper airway from the base of the skull, and the trachea or windpipe. The anatomic relationship between these three structures has an important role in the incidence of upper airway disease in horses, and truly extracting what those relationships are requires a very accurate 3D representation of where those structures are within space, not only in normal horses, but in affected horses, and comparing those two things to each other to help us to understand better what would the makeup of the upper airway look like in 3 dimensions in a normal horse compared to a horse who we know is affected with one of the diseases of interest. We've essentially translated our research from exclusively looking at the upper airway to looking at other important diseases of horses, and specifically musculoskeletal, including tendon and ligament injuries. There's a lot of commonality between looking at laryngeal muscles with ultrasound and looking at tendons with ultrasound. In both cases, our eventual goal is to get an accurate, non-invasive, readily available assessment of the actual health status of those tissues without the need for a biopsy, especially when we have an animal that's affected with a tendon injury such as a bow tendon. It's very important for us to be able to not only accurately diagnose the severity at the onset, but also to follow the success of any treatment. The use of 3D ultrasound ties in very well with other developments that are happening in this area, including the use of stem cells and other advanced modalities to treat these tendon injuries. With 3D ultrasound, we can track the size of the injury over time along the entire length of the tendon. This is especially convenient along the back of the cannon bone, where the 3D ultrasound device fits very readily. Horses seem to be tolerating this quite well, and it's allowing us to get a much better picture of, first of all, what is the initial injury that the horse is affected with? Secondly, how successful is our treatment over time at causing that injury to heal? We've initiated use of the 3D ultrasound, first of all, for larynx. We're very interested in understanding how the size of muscle changes in the larynx when the larynx is diseased. And 3D ultrasound is allowing us to get a very accurate depiction of muscle volume. This is a non-invasive way to tell not only how affected is the muscle at the time that we first assess it, but how might any treatments that we might initiate affect the muscle, causing it to become larger. We know from thinking of ourselves working out in the weight room, in the gym, a muscle that gets bigger is stronger and more functional. So when we have a larynx that's diseased, the muscles often start small, and what we want to do is use various interventions to try to cause the muscle to increase in size and have better function. And 3D ultrasound will have a role to play in making that link. I think the most challenging part of working with a species as large as the horse and diagnostic imaging is simply accessing the area of interest. So while our current research focuses on the upper airway, which is one of the smaller areas of the horse, we could have many clinically relevant questions surrounding disease such as colic, where the answer could lie within the middle of the abdomen, which is one of the larger parts of the horse. Diagnostic imaging modalities, because they're designed for humans and therefore smaller subjects, don't always have the capability to get us where we need to go in a species as large as the horse. The next step in our research is to solidify the link that we've long suspected between what we see on the ultrasound screen and what could be found under the microscope if a biopsy were performed. What I mean by that is it's important for us to fully establish how early can we detect disease in horses, how accurately can we do that, and at what rate does the disease progress once we've detected it. And ultrasound will really help us with all three of those questions. Our research has been funded predominantly by Equine Guelph. Other funding has been provided by the American College of Veterinary Radiology, the Equine Foundation of Canada, and Medel Austria.